Hello, welcome to Code Rhetoric with Tam Talk. Hi, my name is Tamara Abraham, founder of Abraham Medical Coding Coach. In today's lesson, we will still be focusing on the nervous system, but specifically targeting the area of pain, which is located in Section 1 under Chapter 6 under letter B, 1A. The ICD-10-CM General Coding Guidelines states that codes in category G89, which represents pain, not elsewhere classified, may be used in conjunction with codes from other categories and chapters to provide more detail about acute or chronic pain and neoplasm-related pain unless otherwise indicated below. If the pain is not specified as acute or chronic, post-thoracotomy, post-procedural, or neoplasm-related pain, do not assign codes from category G89. A code from category G89 should not be assigned if the underlying or definitive diagnosis is known, unless the reason for the encounter is pain control or pain management and not management of the underlying condition. It further states when an admission or encounter is for a procedure aimed at treating the underlying condition, such as spinal fusion and kyphoplasty, a code for the underlying condition, again, such as vertebral fracture or spinal stenosis, should be assigned as the principal diagnosis, and no code from category G89 should be assigned. So the coding guideline that is specific to category G89 as the principal or first listed diagnosis states that category G89 codes are acceptable as principal diagnosis or as the first listed code. When pain control or pain management is the reason for the admission or the encounter, such as a patient with a displaced intervertebral disc, nerve impingement, and severe back pain, presents for injection of steroid into the spinal canal. The underlying cause of the pain should be reported as an additional diagnosis if it is known. When a patient is admitted for the insertion of a neurostimulator for pain control, assign the appropriate pain code as the principal or first listed diagnosis. When an admission or encounter is for a procedure aimed at treating the underlying condition and a neurostimulator is inserted for pain control during the same admission, a code for the underlying condition should be assigned as your principal diagnosis, and the appropriate pain code should be assigned as a secondary diagnosis. So we're into our first coding example. So the patient presents for management of chronic pain stemming from spinal fusion surgery performed 30 days ago. So in this particular scenario, we're actually going to have two book steps. The first one is to identify the chronic pain, and then the second one is to identify the underlying condition. So in our first book step, we're going to locate pain in our ICD-10 index of diseases. So pain is the issue that we're having. Chronic and postoperative describes the type of pain the patient is experiencing. So when we drill down from pain to chronic to postoperative, our ICD-10-CM code should be G89.28. In our second book step, because the patient is coming in, or the chronic pain is stemming from spinal fusion surgery that was performed 30 days prior, we're going to go to status because the patient is currently status post-surgery or status post-procedure. So once we drill down to our ICD-10 code, it should be Z798.890. And so the rationale for this, the patient encounter is focusing on managing the chronic pain. Therefore, the coder should assign code G89.28, which again represents the chronic pain, as their primary diagnosis, and then Z98.890 as our secondary diagnosis, again, because the patient encounter is focusing on managing the patient's pain, and the pain was generated or stemmed from spinal fusion surgery that occurred 30 days prior. Since we know what is triggering the chronic pain, we're to assign it as an additional diagnosis code. So our two codes would be G89.28 and Z98.890. In coding example number 2, our patient presented to the OR of the operating room for kyphoplasty due to initial cervical spinal fracture and pain. So in our first book step, we're going to identify our diagnosis or our main term, which is fracture. Once we identify fracture in the index, we're going to drill down to spine, again, because the patient presented with an initial cervical spinal fracture. And so once we drill down to spine, it actually refers us to vertebrae, again, because vertebrae represents the bone surrounding the spinal cord. And once we identify the vertebrae, we then need to specify which vertebrae of the spinal cord that we're referencing. And since the provider states that the patient presented with a cervical spinal fracture, we're going to identify our vertebrae as cervical. So once we follow our book steps from fracture to spine to vertebrae to cervical, our ICD-10-CM code should be S12.9. However, our code is not coded to the highest specificity, so we want to make sure we code it out to the highest specificity and make sure our fifth, sixth, and seventh placeholders are assigned appropriately. So that code is S12.9XXA. So XX represents our fifth and sixth placeholder, and A represents the initial encounter. So again, that code is S12.9XXA. And our rationale for this, again, the patient presents for surgery due to cervical spinal fracture. The cervical spine starts at the neck. So the fracture is referencing the vertebrae, which represents the bone of the spine, the spinal cord. When locating the ICD-10 code in the index, the spine refers the coder to the vertebrae. And per the coding guideline, when the underlying reason is the purpose of the encounter, then it should be coded as the primary or first listed code. Therefore, the coder should only assign ICD-10 code S12.9XXA for the initial cervical spinal fracture. Our coding tips for this segment starts with number 1. If the reason for the encounter is to manage the pain, then code as primary or first listed diagnosis. The underlying condition or reason for the pain should be listed as an additional diagnosis. Second, if the reason for the encounter is to treat the underlying condition, then the underlying condition should be listed as primary or the first listed diagnosis. Remember to code to the highest specificity. And lastly, when in doubt, always reference your coding guidelines. Well, this concludes our segment on pain management as it relates to the nervous system. To learn more about medical coding, please subscribe to our YouTube channel at Abraham Medical Coding Coach Abraham, or by visiting our website at www.abrahammedicalcodingcoachllc.com. You can also follow us on our social media platforms such as Tumblr, Facebook, Instagram, and LinkedIn. And again, thank you for tuning in.